Hey, everybody, it's David Kemp. I'm your host of the Highway to Health podcast series. Thanks for being here with us. You know, in the past, we've talked about how it'll take a village of innovators, disruptors, and early adopters to get the community of healthcare where we want it to be, to provide better access, better experience, and of course, improved outcomes for our patient community. Today, I'm really excited to have the CEO of PatientFi, Todd Watts, on the show, where we'll talk about how innovative ways to make patient financing and reimbursement processes easier for the patient and for the provider, which of course will open up access to care and options for our patient community when looking for the services that we need. Todd, welcome to Highway to Health.
Thank you so much for having PatientFi on. Appreciate it, David.
Oh, I appreciate you being here. How's everything going?
It's good. It's good. We're based in, as you know, in Orange County in Southern California, and this is about as a gloomy of a day as we get here, but it's nice to have a little change. So, yeah, everything else is going great though. Thank you.
It's a beautiful spot to be in, and I might have to find an excuse to get out there. It's pretty gloomy here in Dallas too, but that's the time of year it is. Yeah. Tell us a little bit about yourself. We'll get into work here in a minute.
Great.
But I always start these conversations with, not where you went to school and those kinds of things, but, I'm always interested from an executive standpoint with how busy you guys are, what you do to carve out time in your day to make sure that you're healthy mentally, physically, and taking care of yourself so that you can be what you need to be when you come into work and when you leave work for your families. Tell us a little bit about your healthy habits and what you try to implement throughout your day.
Yeah. So I wake up every morning at 4:30 and meditate for 2 hours. I'm just kidding. It's a funny question. It's right. It's like, how do you have a life with all the different, plates in the air? And I think that, for me, how do I keep myself healthy, assuming that I am healthy? I do try to on a at least a daily basis, Monday through Friday. Something I've always made a point to do is I'll spend some time in the gym or even running outside every day. Whether it's something, I don't have the schedule sometimes to actually go to the gym every day, but I try to do something active every day. And if that's even something with our kids or going on a hike or a walk. But the more, and I think part of that is mental for sure, but I joke about the meditation. I was being dramatic, but something I've always done now, really started doing it in 2015. And then really it became a practice of mine when I got really busy with PatientFi is every time I kind of roll up into the parking lot back there I'll spend 5 minutes to start my day and just kind of sit in quiet, gather my thoughts. I just left the family. I just dropped my son off at school, and I do the same kind of quiet meditation before and after work. And it sounds cheesy because everybody says, "Oh, meditation for CEOs is what they do," but it's worked wonders for me and kind of been able to separate. Okay, look, my day's ending, and I'm going to spend 5 minutes kind of collecting my thoughts, and now I'm going into dad mode. I got 2 young boys and a very busy family life. So it's, being able to really compartmentalize that is what's worked wonders for me.
I've never purposefully set time away or aside for meditation. When I came on with MarketScale, my family and I, we live about an hour outside of town, and I come into the office every day. And without really even knowing it, the hour drive into the office and then the hour drive home after work has done wonders for me. I feel like when I sit down at my desk in the mornings, I'm ready to go. And I've got a plan and I've got things mentally prepared for what I'm about to do. And I credit that hour drive into the office. Yeah. Not everybody has an hour drive in or really even an hour to spare, but setting that time away or that time aside somehow, some way has helped me in the mornings be more productive right away. And then obviously on the way home, whatever happened during the day, my kids don't really care about it too much.
That's right.
They want me to be dad when I get home. They want me to help them with whatever sports they're playing and homework they're working on. And that hour drive home lets me just kind of put it in the rearview mirror.
Yeah. It's Yeah, I think that commutes can be used for something, and definitely in the positive. It's a little shorter of a commute for me, so I don't have that luxury. So I kind of have to force it, as I mentioned. But it's I love to hear you doing that, because I think in the long term it's a lot more sustainable, and your families will be all the better for it. So it's a good approach to take advantage of.
It's not exactly a balance, but
Yeah, that's right.
because every day is different, but you've got to do your part. How's the shoulder? I know you're working on.
And I have 4 cups of coffee every morning, I should say that.
Yeah, that helps.
Which is extremely healthy.
That
Shoulder is great. Thanks for asking. I should have last time we spoke, I told you I was in the middle of just recovering from a surgery, so I have no sling on. I was and so I just had a pretty significant labrum surgery, and it's called a ladder J for those that are I suppose the orthopedic, if someone out there in the orthopedic audience is listening. But it's it's been a long time of stress, just as far as I've been able to live with my kids and all this stuff. So it's something that second surgery, and now I'm feeling great. So thank you for asking.
Good. Well, good to hear. Shoulders are tricky.
That's right.
There's no doubt about that. You've got an interesting background. We won't get into all the details, but I'm always talking about how I think how important it is to have a holistic approach and a perspective, maybe sometimes even outside of the healthcare industry, when bringing some ideas, innovation, expertise to healthcare. Tell us why you decided to get into healthcare, and then more importantly, what's kept you in it. It's one thing to start down this healthcare journey, but then you look at companies like Google and JP Morgan and some of these others that got in, dipped their toe into the water, and then a couple of years later they get the heck out of here. So why'd you get in, and more importantly, why have you stayed?
Yeah, I mean, look, it's particularly for what PatientFi does, and kind of what the last 10 years of my career has been focused on. It's certainly something that's tricky to navigate, a lot of barriers to entry. So I think that one of the reasons it's something that's always attracted me is you're able to solve real problems and be able to add anytime there's kind of some level of dysfunction in an industry, that creates more opportunity, right? It also, though, can for sure lead to a lot of failure and people exiting the industry. So why did I initially get into healthcare? Like anything else, some of it is just coincidence. Some of it is there's a lot of intention behind it. I was actually an investment banker, and I'm not going to get in a lot into my background, but I was working at JP Morgan. It's funny, I heard you say that. And I was working in the consumer, retail, and healthcare sectors as an M&A guy in the middle of Wall Street. And I just kind of gotten into that through a recruiting event when I was at grad school at Yale, and it's just kind of random. And I was a complete financial services guy before that, had nothing to do with healthcare. And I moved back, kind of this is where I'm from New York City, to work in a healthcare specific venture. And so what initially kind of piqued my interest was for sure some of the exposure I had at JP Morgan, and a lot of the problems using the latest technologies and the latest developments and consumer conveniences that we see in every other industry hasn't really made its way to healthcare. And that's our last business I was in had a patient financing that was a huge part of the infrastructure of the company. And I saw through that, and it's really what led me wanting to do PatientFi, is that evolution of, wow, there is so much value by just delivering something that consumers and businesses expect in other industries. And if you can deliver that same level of value and convenience to doctors and patients, you have a business that's not just that's the potential to make to add enterprise value and value as an investment, but also you can add a lot of value to the key stakeholders in the industry. So that in general, that's what has always interested me about healthcare. Is look, it is what it is. It's usually 10 years behind everything else from a technology perspective, and so there's just so much opportunity to solve problems.
There are. There's some reasons why it's 10 years behind, right? There's some challenges in this industry that you might not find in other places, in other industries, which is, cause and effect. But you're right. There are usually some some opportunities. What's been the biggest shock of your healthcare career so far? When you got into healthcare, you probably had a plan. What's the one thing that just may have smacked you right in the mouth and you were like, holy cow, I wasn't expecting that, good or bad? What's the biggest shock?
Healthcare, you think, lending and consumer finance, PatientFi is a patient financing company, and I've been in, the industry even before that, particularly is, healthcare regulation and the pace at which, look, the government's very involved in everything that healthcare happens. It moves slower than even, or it's created more barriers to progress than what we see even in consumer finance, and that's been systemic across the industry. If the pace of innovation and the pace of commercial innovation is slow due to whether it's agencies and it's indirectly from the government, everyone gets used to moving slow because you have to, right? The rules are set, so med device moves slow. I'm shocked how you have to really plan long term, and that's where you see this kind of a clash of a culture between Google's going to come into healthcare. They're used to moving at 10,000 times the speed of everybody else. You run into something like healthcare, it's going to move at the pace it needs to move at. So learning how to operate a new venture that is trying to add value, and we got a lot of people from the tech industry here within the confines of an industry that generally moves pretty darn slow. That's been a shock to me in learning how to be patient where we need to be and be able to learn where we can press and try to expedite initiatives where there's an opening to do so.
Yeah, and with that said, there's no shortage of innovation in healthcare. And when I say that, I mean, you look around and there are a lot of new ideas, new mousetraps, different ways to look at it. What it comes down to, I think, is everybody trying to deliver the type of experience that consumers get everywhere else. Because, with the Amazon, the Netflix, the consumer experiences in those ways are now the expectation of the consumer in healthcare. And PatientFi is doing a lot to address and meet that expectation. But there's some challenges there. Tell us what, traditionally, what that interaction would look like for a patient, and maybe the person at the provider that's providing that education to the patient about what their options are financially. Traditionally, what does that process look? And then how is PatientFi addressing and meeting those challenges?
Yeah, I would just say one thing in general is, I don't think, and I wasn't challenging before, the pace of clinical innovation in healthcare. I think there's a lot of opportunities as far as how, the process in FDA, and people could argue that CMS, and I'll get to your question, but just clinical innovation, I think, is pretty good. New products, new things. The thing I'm really addressing is you got all these great products, but nobody's figuring out or focusing enough on what's the best way to get these great clinical outcomes that med device and the pharma industry is created to the consumer in a way that's increases access. And then that's where the opportunity for, now to directly answer your question around PatientFi is, you have all this these great products that could change lives. One of the big things is, how do you get the water kind of right to the end of the row? And that is, how do you get these great clinical products to the providers in a way that is seamless? And then from the providers, doctors, hospitals, independent practices to the patients. And that's where the big problem that we saw to solve with PatientFi is that, and there's a number of studies on this. A good statistic I love to reference is, for everybody who doesn't get a cash pay procedure, and this is just as an example, so that means something could have a large deductible or something that's completely cosmetic or LASIK. 40% of the people that don't move forward with that procedure is due to affordability, and all of that 40% of the people. So this is an example. I need to go back and requote myself, Dave, because that statistic is not right. So 40% of the people that otherwise would not have moved forward with a procedure, whether it's a clinical procedure, an independent practice, or a high deductible procedure, 40% of those people that said no would have moved forward if they had been presented with a payment plan, so a more affordable way to pay for it. And that's kind of the big gap that PatientFi has been able to solve, is helping providers offer in a completely seamless way that monthly more affordable option to patients. And that's where PatientFi has kind of created a turnkey solution for that, is where it doesn't create a lot of training and effort for the provider to seamlessly change and help more patients understand that, wow, we can afford LASIK surgery, we can afford this really high deductible orthopedic surgery or something, that so that more of patients can be aware that, hey, look, I can afford this life-changing procedure. Doctor wins because they're able to treat more patients, and then patient access improves.
Yeah. You bring up LASIK, and I think that's a really good example, because we know in a lot of those situations it's not covered, right? Or the deductible is too high. I relate it to our listeners. I relate it to a big personal purchase that we make, whether it's a new vehicle, a car for our kid, something that we can't pay cash for up front, but there are options. There's a number of options of ways to finance it and make it affordable in bite-sized portions. Following that analogy, how does PatientFi take LASIK, for example? How do you walk us through the steps here? What makes PatientFi a good option for a patient that needs or is hoping for a surgery, an operation like LASIK that would improve their quality of life significantly, but just might not have the upfront cash or coverage that they need?
Yeah. The average price of LASIK, I mean, it's easily $4,000 or $5,000, or if it's even cataract surgery and you want to upgrade to a premium IOL, that's cash pay that on average, the average consumer doesn't have. The average consumer needs LASIK just as much as someone who can pay up front. Where I think it all starts with, because look, there is other financing options. Our tagline, it's PatientFi, and underneath it says the friendly way to pay. And I think that's been something that I've certainly not been willing to compromise since from the beginning, is, something that might work for a financing product for furniture sales. That same product, in my opinion, shouldn't be right in a clinical setting. It's doctor, first thing is do no harm, right? They want to offer a product that is fair, transparent, the patient understands. You can't ask a patient to understand this completely complex offering while considering whether they want to have a surgery that could have risk and everything else associated with it. So where we've just bedrock started is we have to have a product that's easy to understand. We take care of all of our patient borrowers. We try to be as fair as possible and make an experience that's completely seamless. So now when a patient, let's just say, to walk you through, like they walk into a practice's in your example, a ophthalmologist, if it's a successful PatientFi practice, or there's someone that uses us, right there on the wall, they'll see, before they have to go in and learn about the clinical pieces of it and then be shocked by, wow, this could really benefit me. But then at the very end of the consult, they find out it's $6,000. Right there in the office, we're presented a monthly payment option to all of the patients in the waiting room, that they know, hey, look, this is something that I can afford, and it's going to be because I can afford $149 per month. And then that's where, to make this all work and really change the paradigm of how the patient access and pricing is, our application is 90% is done on their phone. They can just scan a QR code and everything is immediate. There's no hard credit check. It allows, it's something that they can quickly find out that, hey, look, before they even walked into the office, this is something I can afford. Let's focus on now the clinical and life-changing benefits. And that's where the doctor obviously does what he does and let us do take that out of the equation early on. And that even happens, I should mention, sometimes not just in the waiting room, but our practices, we have turnkey ability for them to market to prospective patients, to make it in a way that's very clear for those patients to understand that they have access to a friendly way to pay, affordable payment plan right up front before they even walk into the office.
Yeah, and that's actually the piece that I want to touch on too, because not only does the patient need to be educated on what their options are, but who does that education most of the time? It sounds like PatientFi helps, but there's front desk personnel, there's care coordinators, there's financial counselors, there's call center people that are all getting the questions from the patient about their payment options. And the more simple the option like PatientFi is, the easier that communication is, the more transparency is provided ultimately to the patient on what options are available. I'm sure education for the clinics and the patients is a high priority for you guys.
So we're one of the only, the latest I saw, one of the only patient financing companies that completely gives uh, the payment plan option of, we offer a range of different products and all sorts of different term lengths and things, as we actually put it into the hands of the patient that they have to select it. And what I mean that is it's all happening on mobile, but we're presenting those plans to the patient. They're selecting the plan that whether it's 36 months or 48 months and the interest rates, they're selecting those plans. And our interest rates range from 0%, no interest, all the way up to, having interest where borrowers that have less credit can get access to procedures.
Right.
And that all, we really have, and this is critical, is giving the kind of power of choice and more choices, put it into the patient's hands. One, because that's where it should be. Unfortunately, if front desk and the staff have enough to do, I don't think it's appropriate to say, hey, yeah, by the way, can I, let me teach you how to pitch a mortgage, right? It's not a mortgage,
Right.
but you know what I mean? And let the patient, they're completely capable of making choices, especially ones that are financial. And I think we've been able to do, I think, a really differentiated job of keeping that relationship between the patient and patient-fi, and the practices love it because it offloads the burden of having to educate the patient too much on that.
You know what? And it gives some privacy to the patient too.
Yep.
To be able to make that decision privately instead of having to talk through it and almost feel like you're negotiating with somebody there at the clinic.
Yeah.
And
I think, go ahead.
No,
Sorry.
After you.
I was just going to say that to that end, I mean, this isn't just, and we've always been that way, and uncompromisingly so as it relates to putting the choice and over disclosure wherever we can to the patient. And trust me, lenders can move faster if they try to, hide stuff in the background and things. And we probably could have grown faster if we were willing to compromise on some of our disclosures and being able to be very upfront with the patient. But there is even legislation, for your viewers should know that, this industry has been around for a long time, and doesn't mean it's what it is today. And when I mean industry, I mean patient financing. And just in California, there's legislation just a few years ago where it's a particular product that's called a deferred interest product, where practices for decades used to apply on behalf of patients for patient financing. So they would fill out hey, patient, give me all the information. I'm going to fill it all out for you. Still happens today all over the country. And these are sometimes high interest rate products, and the provider, healthcare expert provider, is filling these out on behalf of the patient. For deferred interest products, Senate Bill 3681 in California, you no longer can apply it's against the law on behalf of patients for deferred interest products. And that's something we've always done. And it's nice to see that the government is starting to wise up to say, hey, look, put the power of the choice and the financing option they're picking, and the patient needs to be the one deciding. So it's nice to see that. And I think that theme will continue, where some of the other practices where providers have dealt with this and have been in control of it, patient-fi now is kind of, again, always had that same theme of letting the practice staying out of the financing discussion, which I think is a benefit.
Yeah, I do too. And when you look at the most disruptive, companies really in any industry right now, it's the ones that are empowering the individual
Yep.
to make whatever choice they want, whatever strategy they prefer. And, I've seen this now on a few of these conversations on the podcast where, these companies like PatientFi that are looking to bring the experience that you get in other industries to healthcare are doing exactly that.
Yeah,
they're putting the power back in the hands of the patient.
I think the nuance of it is, if your practices are used to clunky systems, right? It's kind of, remember we were talking about, like, if you're in healthcare, you got to get used to moving the pace of how things move, right? And trust me, the practices and the people that interact with the systems and whether it's practice management, EMR, reimbursement with insurance companies, Medicare, Medicaid, go down, all of it, they're used to things that, gosh, that's not efficient, but I'm just going to deal with it. Consumers are not, the rest of their lives are easy, convenient, fast, mobile enabled, right? Completely digital. That's where to deliver choice and the things that I think that provide more access, and if you're going to move that away from the responsibility of the practice into the patient's hands, you better be able to deliver something that is an experience that, like you mentioned, Amazon, Google, these other companies have been able to deliver an experience that's seamless, really easy, and what consumers have come to expect. And that's where we've spent a lot of our allocation of resources, is continuing to be, no, it's not easy enough. Make it easier, make it easier, make it easier.
And there's dual benefit here, it seems like. Correct me if I'm wrong, but not only are you empowering the patient, but you're offloading some of that work from the provider.
100%.
And we know how hard it is to find, hire, and retain talent nowadays. So you're taking a lot of that burden off of the provider, allowing them to work a little bit more in a lean fashion.
Yep, absolutely. I think the PatientFi has a lot of different, I would say, kind of product features, and there's a lot of things and improvements we've made over the years. But I'd say, what's the overarching theme? Friendly way to pay to the patient, but more than anything, it's probably the easiest patient financing company to use for the patient and the provider. And that kind of creates a lasting value for everybody.
Yeah, when you think of the biggest challenges in healthcare right now, it's what we just talked about, retaining top talent. But it's also, consumerism, where, especially with more of these elective procedures, patients are looking around and they're shopping around.
Yep.
And this is a competitive advantage for the clinics that you're working with, the offices that you're working with, because the patient has more power, and it's a benefit that these clinics can offer their patient community, which might give them more options, but also provide the experience that gets them in the door in the very first place.
Yeah, I think for our practices, and we have thousands of practices now across most of the states in the U.S. You'll find, just kind of like that waiting room example I mentioned, and that's why I'm hopeful that more and more providers start to do this, and candidly, with or without PatientFi. But PatientFi practices, the price of, let's just say something you mentioned, elective. So let's say something for cosmetic, and we're in a lot of plastic surgery and med spas across the country, is Botox. Something like Botox for shouldn't be this clunky $700 three times a year. It just should be $99 a month, and the consumers are used to paying this way. And our practices, usually you'll be able to spot a PatientFi practice when you're starting to see them quote the cost of procedures on a monthly payment. So LASIK is not $7,000 anymore; it's $149 a month. That's the cost. Just like a Peloton, it's what consumers have come to expect, and it's a great way for practices to get folks into their practice. And then look, if they end up using this, a lot of times they'll come in because they see this affordable monthly payment, and they'll end up using their American Express card or pay out of their checking account. But there's so much underserved patients out there, or practices that aren't reaching demographics that they otherwise could, that because they're not addressing affordability upfront.
Yeah, I couldn't agree more. Tell us how you guys are going about this education piece, because we know in healthcare, sales is more education than it is pitch. So you're kind of in this position where you have to educate multiple communities. You're educating the provider, you're educating the patient. There's probably other partners that you're working with that you have to educate. How are you providing that education, and through what channels are you delivering that information?
Yeah, and I think the only revision to that question I would say is, how are you doing that cost efficiently? Because I think that the message is clear, how what we want practices to learn and how to change. It's just, how do you get that message delivered to the practices in a cost efficient way that you're not spending all your resources on education, because look, we all have investors as well. And that's where one thing that makes PatientFi really different is we actually partnered very early on, and still partner with today in new specialties beyond aesthetics, but we've partnered with the medical device community. Allergan Aesthetics is our partner, as an example, in the medical aesthetics, which is plastic surgery, med spas, dermatology, where we partner with their commercial team and to be able to get, again, the information to the end of the row as it relates to how to change how practices should be marketing procedures, how to address affordability. So it's been remarkably successful where we've partnered with the med device community like that and utilized their sales forces as partners and they're already in those practices, right? They're already seeing them every day selling their products. They're looking for differentiated ways. And look, if you address affordability, what's the win-win is the med device company will sell more product. And the practice is going to sell more product. Patients get access. So the sales forces are naturally incentivized to educate practices and say, hey, look, I'm going to sell you this product practice or provider to use in procedures. And here's all the clinical reasons why we should do that. Okay, great. Well, let's not lose the fact that providers are businesses and they have to make money too. Otherwise, they're not going to be able to help patients. So the next thing that, where the Patientify comes in for those salespeople of medical device products is, here's why you should use this and why it's great for your patients. And then, by the way, let me show you how to sell more of this product to help more patients, because I've already shown you the clinical benefits. But now by addressing affordability, instead of just, helping the people I can pay a $7,000 check or whatever it is up front, we can help a lot more. Well, that if the sales rep is incentivized to do it because they're going to sell more product.
Right.
And we've seen dramatic results with our med device partners where if they're using Patientify, they're selling 200% more product, meaning the med device manufacturer to those practices using Patientify than they are to some of the other practices that are just in that same marketing paradigm of upfront costs and it being quite expensive. So
yeah, and you said it earlier. There's 40% of those patients that don't come in would have if they had a cost-effective or a feasible way to pay for that procedure.
And just think about it's a dramatic example, but it is what it is. Think about the implications to the industry. Let's just talk about medical aesthetics again. Where if more patients were educated on that we can make procedures more affordable, the whole industry could be significantly larger. And that's not just a medical aesthetics issue. That's a same thing for all of the other medical specialties. I don't think there's been an appreciation for how much affordability has hindered. Clearly, the United States of healthcare is more expensive than everywhere else in the country. The cost, we all know that, but one of the ways you can really help that is the answer is not everybody needs to reduce flat price, right? The average reimbursement for Medicare and Medicaid has dramatically fallen for doctors. Like if you look at cataract surgery as an example, or knee replacement, go look at all of them. How much doctors make from reimbursement is falling. Cost of living, everything else, particularly today, is increasing significantly. That's not sustainable. You have to make things more affordable by giving people the ability to budget. Reducing cost isn't the answer. All the practices can't just go, okay, the cost of LASIK is now $2,000. Well, the providers, it's going to be a really busy couple months and then they're out of business. So the answer is make it more affordable. And that can be done through a payment plan.
So what's next? I mean, we've talked a lot about these specialties and even electives, but you touched on it briefly just there. What's next for Patientify? Is there an avenue to, larger care episodes, whether it's acute care or, these larger procedures that are more, I don't know what the word might be, but, maybe complex health issues? Is there a place for Patientify in that setting, in that healthcare setting?
Yeah, and I think it's the elephant in the room is this works, and I think we've shown it works really well for cash pay procedures. Things that are the kind of question is can you solve the monstrous problem, which is people that fall and break their hip and they need a procedure now, and this is a disease-based or catastrophic care-based procedure that's done at a hospital and it's reimbursed is something that we've been kind of, and it's on the horizon. But really, I think you got to prove the business first in the cash pay setting, which is a $260 billion market opportunity in of itself. But now let's look at really being able to help with, really it comes down to deductibles, right? And the way PatientFi works is you get we can pre-qualify you. I mentioned earlier and earlier in the patient life cycle. And that should happen, pre-qualify for payment. Doesn't need to be tied. You don't need to think, oh gosh, I know the cost of my procedure to be able to have access to credit. We can evaluate what your access or your credit availability let's say if you need to borrow $10,000 upfront, and it can happen closer up in that kind of life cycle for the patient that's going to go in, find out how much something is, and then there's going to be a deductible, and then there's going to be insurance that comes up, and ultimately they're going to be responsible if it's not a deductible, maybe a significant copay. There's no reason you can't approve those patients higher up in that life cycle before, so that they know, hey, look, when ultimately that comes, that you've already kind of done the credit checks. What the problem that hasn't been solved yet, and and we're working on it in a way that I think is fair to the patient, is someone falls and hurts themselves. Somebody finds out that there is a immediate need, and it's a life or death, or that's probably the most dramatic example, but significant change to their health. They'll agree to just about anything. Yeah. And if they can't afford the monthly payment plan, someone would be perfectly willing to destroy their credit to be able to fix something. And that's where it gets, the problem gets very, very nuanced, is if patient financing companies are trying to lend to patients like that, ultimately that won't be a long-term sustainable business, because you need to charge interest, and there needs to be a profit generating business. And if someone has no credit, the math will always be is that you need to charge that person more interest. But if someone breaks and falls and hurts their hip, and they have a really low credit profile, and most likely the lender knows that they're not going to pay you back, you need to charge that patient a lot of interest. But now you're charging someone who's catastrophic incident, right, clinical setting, and you're charging them a ton of interest. That doesn't suit well with me. I don't think that's appropriate. So that's where the provider sharing in some of those costs can create a pretty compelling solution. Because look, the provider doesn't get paid, he gets zero. The provider, and this again is we're just talking about kind of reimbursed disease-based acute care, where the provider, if they can share in some of that cost, you can deliver a win-win for everybody. And that's where I think a big opportunity for PatientFi as well is being able to start to work on solving some of those problems. But I wish I had the answer and the product was done today to be able to solve that piece of the business, but it's certainly coming. And it's I think probably one of the biggest, most unaddressed market problems in all of healthcare is, how do you make things more affordable for acute reimbursed care if people can't afford to make payments?
I mean, there's a lot of angles that you come at it. I was talking to a gentleman earlier this week, or I guess last week, that was talking about, early detection and prevention, and using those things to avoid the big catastrophic health events. But then there's things like you're describing, where it's a car accident. It's these things that you can't prevent, that cause financial toxicity in terms of just your family's well-being financially. And when those things unfortunately do happen, options are needed. And it sounds like PatientFi and others are on their way to exploring those ideas. If there was one thing that you wanted our listeners to walk away from today, maybe it's something you touched on already that you want to reiterate, maybe it's something we haven't talked about, what's the one thing you want our listeners to walk away understanding?
There's two problems, I think, that from my view, and there's a lot of opinions on this, that are in healthcare. And those two problems are between technology and affordability. It is the lack of technology and the lack of affordability. Creates this tremendous amounts. I think that's what's the systemic issue in healthcare that has created a lot of the leakage that then goes through the system that changes the pace at which we can innovate, that changes the pace at which providers are able to provide better care, because if people, they don't get paid, they can't provide the care they need. It is one of the, I think if you got down to some of the root causes of where healthcare, where we could solve a lot of problems. And that's what I would say excites me and my executive team. And I think I have the best in the world that's on a mission to solve that problem, is, you know, where PatientFi hopes to continue to lead the charges, is that delivering the best technology combined with a fair and very forward-thinking way of lending to patients. Can't solve the whole problem. We got big goals, but I think they're practical, and that is, you know, we can really, and that's makes this the most fun of anything I've ever done, is you can really improve a lot of issues in the system. And it's a great business. And the more it can be a great business for us, the more we can continue to solve those problems, improve patient access, help providers treat more patients, and do so in a way that's sustainable. I'll tell you, it's a rare opportunity, and we're kind of at that juncture where it's needed more than ever. And we're having fun trying to solve it.
Well, it's going to take a village of folks to make it right. And I'm proud to say that, you've taught us a lot about what's out there today and what's coming. And so thank you for being a part of Highway to Health. Best of luck to you. And if there's anything that we can do to help, let us know.
Thanks. I enjoyed it. Thanks, David. Appreciate it.
Thanks, Todd.